From the studios of KENW on the campus of Eastern New Mexico University, it's You Should Know, featuring the people and events of Eastern New Mexico and West Texas.
With me now in the studio is Dr. Mary Mason, and she has a very wonderful thing to tell us about that's going to be very helpful as far as I'm concerned, and that is how to help your children when it's time for them to go to the doctor's office, and how to look at medical health, and believe it or not, we need to include them in things like that. They're the patient after all. So, Dr. Mason, tell me about Little Medical School.
Sure. So about 21 years ago, I was a resident in internal medicine at Washington University in St. Louis. And I decided I wanted to come up with an idea that really captured what my mother, who was a pediatrician, used to do for me when I was a kid, where she would bring things home from the office, where I had my own stethoscope and black bag and reflex hammer. And when as I got older, I realized how important those early experiences were when I decided to choose a career in medicine. So that's what I wanted to do, to have this mini medical school that would inspire children to consider careers in healthcare. And so really this idea kind of grew over the years, and we actually decided to franchise in 2015, so we would be all over the country. And actually, we are in about 13 countries as well. And so it's something that's really gone from beyond, any type of imagination that I had of what this could be. So this is something that has really been great, especially with the pandemic, now that we realize how important healthcare is.
Okay, what are some tips that you can give our viewers when they're preparing their child to take them to the doctor's office? That can be traumatic sometimes for the child if they're not prepared. What are some good things they could do ahead of time?
Right. And as a mother of three, I've had my struggles over the years when I'm trying to get my children in for their regular checkups. And it really depends on the child. Some children are extremely interested and they want to see what's going on in the doctor's office, and they're fine with it. And there's other kids who are hiding in their bedroom because they don't want to go to the doctor. I think it's incredibly important to be honest with your child. If you know they have to get immunizations, be honest about it and tell them about it. And so they can be prepared. And I actually find that using role playing can be very helpful. For example, we use in our little medical school, we use these little cute patients. And this is something that, your child can get one of their stuffed animals, and they can, if they know that they're going to get some vaccinations, you can practice of what's going to happen, and then also have them bring this to the office with them. It can really help, especially young children.
Okay, explain to me what Little Medical School is, and talk to me about it a little so the folks at home will understand what you're talking about there.
Yeah, so Little Medical School, we are an after-school program, summer camps, scouting programs. We are a mini medical school that puts kids in the position of role-playing physicians, nurses, pharmacists, veterinarians. And we really let them use their imagination and put them into real situations that a healthcare professional may encounter. For example, giving a vaccination or suturing or doing Tommy John surgery. And what we're really trying to do with children, and we start as young as 1 to 3 with a parent and me class, but it's really the target I find is that 3 to 14 age group, where we're really trying to get them to think about being healthcare professionals.
Okay, well, how can parents relieve anxiety in children when they're going, say, to be vaccinated?
Right. And anxiety is a very common thing, especially if they know, for example, they need to go to get their flu shot. So role playing is important, being honest, but also use this as an opportunity to teach about science. And there's so many great resources out there, on the internet that you can find to really show kids how a vaccination works. And that's something that we do in our classes where we actually do an antigen antibody game. So they kind of understand with the flu shot what's going on. And when they understand the science, it's empowering. And it's going to help with that anxiety.
Do you ever have them act out going to the doctor? One actor is the doctor, the other is the patient. They decide on what kind of problem they're having before they start, and they just go through all of the process of going to the doctor's office.
Right. And role playing can be such a powerful tool. One of the things that we do with our classes, and I think this is even helpful if your child has a lot of anxiety going to the doctor or to the hospital, is we give white coats. And you can see one in the back here. And we also give real stethoscopes and teach the kids how to use them. And so that can be kind of their cape. If they're scared to go, they can put that white coat on. And then when they're at the doctor's office or the hospital, they have a white coat, the healthcare professionals do, and it can make them feel like they're much more part of the process. And so that's something that we find that is really helpful. And in all of our classes, you will see our kids, they get the white coat at the beginning of the class, and then they go and they wear it every time they come back. They're wearing that white coat, and they wear them at graduation, and they take the little medical school oath. So something like that of really using dress up. And I have found that, even with like 12 and 13-year-olds, they love to do that. And it is something that has worked very well for us. And I think it's a great technique to really help with that anxiety.
Very good. Do you allow, can we allow our children, for instance, to take their stuffed toy, their favorite stuffed toy, teddy bear, monkey, elephant, whatever, and work with that in case out here we don't have your a school yet, and
right.
So can we let them take a stuffed toy? Is that a good idea to send it with them so that they're not alone? They've got this friend right there that they hold on to and talk with, those sorts of things.
I think it's a great idea, especially with younger children, to let them bring one of their loveys, a stuffed animal or a baby with them to the doctor. I think that really does help. And as I said, you can use it in the role play, where if the doctor or the nurse is about to examine them or give them the vaccination, they can actually role play it first on their stuffed animal, and then they can be the patient. So that is a very helpful technique, especially for younger children.
Okay, well, let's talk about what is it like for doctors to work with children who are afraid, who they're not cooperative. That's a problem for the doctor, isn't it?
It can be. And doctors' offices are normally set up with nurses and your medical techs and the receptionist to really make the children feel comfortable when they come in. But if it's something that you are concerned about or know that your child has a history of having anxiety before they go to see the doctor or go to the hospital, talk to the office ahead of time, because there's many techniques that they can do. And sometimes I think it's as easy as changing the focus. So use it as an opportunity to point out who's working in the doctor's office or who's working at the hospital. There's dietitians, there's physical therapists, there's occupational therapists, there's EMTs. And so you can use that as an opportunity to show your child it's not just being about a doctor and nurse as a career choice, but there's all these other people working in the office. And that's a great way to shift the focus from, my goodness, I'm getting a shot with a big needle, to now, you can actually look at it in a different way. And I think that can be very helpful as well.
Very good. Tell me how you got started and what your idea was. This is a franchise, is it not? People can actually open a little medical school in areas around the country. Is that right?
Yes. So we started in St. Louis in 1999. And I was just doing these just a few at a time. It was just an idea that I had. I was recruiting local college students and medical students to help me teach. And it was something that all of a sudden I start getting calls from different schools saying, I hear you're in this school. We would love for you to be over here. And so it was the summer of 2010. We were actually doing a program with St. Louis University where they do a big summer program, and a lot of children from out of town were there. And I start getting calls from Texas and Florida saying, when are you going to be here? So that's when we decided to franchise, because I think there's so many people who love education, they love medicine. Workforce development, we know, is so important. And all you have to do is watch the news or look at, at what has happened with the pandemic. We need future healthcare workers. So this was a great thing for me to be able to find people in different markets who would want to open their own little medical school. And then we can completely support them. And you don't even need an office, because really this is a mobile business where you can go into schools and community centers and all sorts of different places to run programs.
Well, yes, it is a worthwhile program. And for instance, I'm sure churches would allow you to use their auditoriums or their fellowship halls, those sorts of things out here. You've been doing this a long time now. Has it been long enough for you to know some of your former participants at Little Medical School who've actually gone to be a nurse, an ultrasound sonographer, some other medicine type job?
Yeah, we do hear from many of our former students who, especially what I like to hear is when they tell us, I didn't realize how important science and math was until I did Little Medical School. And now I'm in high school and I'm studying hard. But I also have some of my early instructors who were college students when they started and now are attending physicians. And the thing that has been really great about this is, even though it's focused on children and teenagers, we actually also are helping the instructors, because many of them are in their time of, in their educational time still, whether it's college, medical school, nursing school, pharmacy school. And I think if you really want to be a great healthcare professional, you have to be able to teach concepts so that people understand them. And so it also gives our instructors a really great opportunity to become the best healthcare professionals they can be.
I think it's interesting that nowadays at medical schools, they actually have, I don't want to say dummies, they have a human being that's not real, but it's got all the body parts, and the medical students have to operate and find things like the liver and the kidneys, those sorts of things. And that's kind of like taking your stuffed toy with you to the doctor's office, only you've got this stuffed man lying on the bed there. And I remember, and this is going to give you my age here, but I remember when they first came out with the game, okay, that was called Operation, and you had tweezers, and if your tweezers touched the outside of the body,
I had Operation as well. I did. So, no, but that's the other thing that has also come out of this, because we did start getting requests for our programming in areas where we were not. So we do have educational kits. I mean, I have an example right here. This is our sports medicine kit. We have pediatrician, we have wilderness medicine. We also have how to be a great sibling if you have a child having a new baby brother or sister coming home, because really these are opportunities to learn about science. And I think that what I also find so interesting is veterinarian is so popular for us. And we have a dog, a cat, we have the horse, and exotic animals. And there's so many kids who don't think they're good at science because they don't like robotics or they don't like engineering, but they come to our veterinarian class and all of a sudden they're like, this is fantastic. And it's amazing to see their face when you say you're doing science. And they're like, oh, I didn't know I was good at that, or I didn't know I liked that. And so that's really what has been so great about this program and fulfilling for me, is to find these kids who may have just decided, I'm not good at science or math. And all of a sudden, we may be putting them on the path to being a fantastic surgeon or pharmacist or dietitian.
I particularly like the part about veterinarians. We are on the east side of the state of New Mexico here with our viewers, and we have a lot of dairies and cattle ranches, and many people have horses, of course, and so we sure could use some large animal veterinarians out here. So I'll give you a little advice. Try to include a horse and a cow when you're working on
we actually have a horse kit, and we have horse classes and horse summer camp. That was probably one of our most popular offerings this summer. Wilderness medicine has also been a really great program for us, and we also have an activity kit as well for that. And that's something that many parents sent with their children to sleepaway camp. And it has a survival tool. They learn how to splint a broken leg, that we do role play that they're on a hike with one of their friends and they fall. And what do you do? Because the other thing that has come out of this, and I think in this technology age, we always think we can solve problems. And I see this with kids all the time with their cell phone. So if you're in the middle of the wilderness or you're on a hike and your cell phone's not working, you can't call your mom or dad. You have to figure out how to do this yourself. So we're really teaching life skills through first aid. We also talk about CPR and Heimlich. And even for 12-year-olds, we can do CPR training and basic life support training through the American Red Cross.
That's a wonderful thing to do. I had an opportunity one time to use, I had watched a show on how to stop bleeding from an artery on television, and then I found myself in the situation out with some kids camping, and I knew how. I knew what to do, and it was sure easier for me to do that, to understand that, hey, this thing's squirting. It's an artery. I've got to stop the bleeding. I knew what to do, push the pressure on there, all of those kinds of things. And so this, what you're doing for these children is wonderful, because that you never know when you're going to get to be the doctor, whether you've been trained or not. It's a good idea.
And what I think has also come out of this is that we want to teach kids how to be accountable patients. So we want, even if you decide you don't want to be a doctor or a nurse or a pharmacist or a veterinarian or a dentist, that's fine. I actually, though, am thrilled when people will come to me and say, you know what? My kid reminded me that they have their well check, or they were asking when they have to go to the dentist because they took little dental school. So that's something that has also, I think, come out of this, is that we have to teach our kids what it's like to be an accountable patient and doing all their preventive health and doing everything they can so they can be healthy.
I noticed on one of the websites that I went to, you can also get a birthday party for children. Tell me about birthday parties.
So science can be very fun, and that is something that we have tried to, really make these classes fun. And so even in the classroom, the kids are having a great time, but then we start getting requests for birthday parties. And we do That Is Gross, where they make mucus and snot. And I will say that's a very popular one, especially with the younger boys. We also do Is There a Doctor in the House, where they get a real stethoscope and they learn to listen to their heart, their lungs, their bowel sounds. They put it together during the birthday party. And the veterinarians as well. One of my favorite activities with the dog is that they get little tick stickers and tweezers, and they put those, they learn to examine the dog on how to look for ticks. They remove the ticks. We talk about tick-borne illnesses. And it is so funny, because you would think, why would a kid want to talk about science at their birthday party? But because of the way we do this and all of our activities, we have designed from the ground up, where I've had board certified physicians, nurses, pharmacists come together with us with teachers. So we're in the language of education, but we're also doing this from a healthcare standpoint. But at the end of the day, we have to make it fun, because I don't want a kid being bored. Because when you think about it, our classes mainly are outside of school time, after school, before school, summer, birthday parties, scouting events. So that's what really has worked well for us. And that's really the appeal of why people want us to do birthday parties.
And that's great. The things come prepared. For instance, a stethoscope, the ones that you have, can actually listen to the heart, can't they?
I'm a big fan of giving the real thing, because kids know it's plastic and doesn't work, but we also are very concerned with safety. So we always make sure that, we are going through protocols with the kids. We don't want them to take a stethoscope and swing it around. And, we want to make sure that they're using it properly. And we spend a lot of time, too, talking to them, especially when they get their white coat during our white coat ceremony at the beginning of a course, of what the responsibility is if you're going to be a student of Little Medical School. And so they also, as they get these real instruments, we also do tuning forks, we do reflex hammers, we have the flashlights so they can learn to examine the eyes and look at the pupils. We really talk to them about how to respect, and be careful when they use these type of instruments. And they do love it, because as they go through our classes, they end up with a whole doctor's office that they can actually set up at home, in a little doctor's bag where they can put all those in. And that's when I think it gets to be so fun, because the kids will bring it back from class to class, because they enjoy using those instruments so much.
Well, something that the average parent maybe even wouldn't think of, and certainly the children, they probably wonder, you mentioned bowel sounds in the stomach area, and the kids probably wonder, well, why are they putting this on my tummy? What they don't know is if there's not a little gurgling going on down there, they could be in trouble, and that's the way the doctor finds out about that. So I think that's a great thing for you.
Right. Well, and if you think back to when you were in school, learning digestion probably wasn't the most exciting thing in middle school or grade school science. We do digestion, and this is, I think, a great example of how we teach. We do it as an assembly line. One kid is the mouth, one kid is the esophagus, one person is the stomach, one is the small intestine, large intestine. And we have a bucket that we pass down to each kid, and they take turns being each part. So, for example, when you get to the small intestine, they have a little strainer that they're actually scooping out the digested food, which is supposed to be the nutrients being pulled out of the small intestine. The large intestine throws a sponge in because you're soaking up the extra fluid. And then we have, to be politically correct, the end, where they dump it into the waste can and then they start over. But the thing that's so great about that is that kids then understand the function, and they understand how things work and what order they're in, and they can recite this, when they go home. And, it's always funny. I used to have so many physician kids that would be coming to the classes, and I was always like, oh my goodness, this is going to be a tough customer here. And I would get calls from physicians saying, thank you for teaching my kids this. They wouldn't listen to me, but now they're all excited about this. And so if you make it fun, and you make it and do it in a way that's the language of education and how kids are used to learning, you can teach them very complex concepts and they remember it.
Okay, one last thing. Let's talk about, again, what parents can do just before it's time to go to the doctor, or maybe a couple of days or the night before at supper, to ease the tension that comes when a child is kind of afraid of going to the doctor's office.
One of the first things to do when your child says they don't want to go is ask them why. Because sometimes it may be something that is irrelevant to the current visit. It may be something that happened. I'll use the example of when they used to do the flu mist. where it would go up your nose. And kids, there were some kids who are like, I don't want to do that. Well, we don't give flu mist anymore. We're doing this, we're only doing the injection. So it's important to ask why you don't want to go. The next thing to do is to be honest with them. Tell them this is what's going to happen. And you can call your doctor's office before, even especially with a well visit. They know what the schedule is for immunization. So you want to talk to them about that. This is what's going to happen. Never lie to them saying, I don't think you need shots this time, even though you know they do, because that's a very bad precedent to set. Also, try to use science as a way to empower them and tell them why they're getting it, how it works, and use that as an opportunity to teach about STEM. You can also then, and I want to call it the distraction, but point out other things going in the office. Hey, did you see the doctor has an X-ray machine? What do you think they use that for? That the tech who's taking the X-ray, what do you think they did to get in that job? And so you can use that opportunity of going to the doctor's office or the hospital as a way to really start showing kids all the opportunities in healthcare. Role play is great. Let them bring a stuffed animal if they have it. You can role, especially little kids. You can show them how to what's going to happen if it is a shot or if they're going to get examined or whatever is going to happen. You can role play it ahead of time. And if they want to wear a little white coat, if they want to bring their little doctor's bag they may have in their toy chest, let them do it. It's something that if you can find a way to make your child feel comfortable, because you want this to be you want it to be, and I'm not going to say a good experience, because we all, we know we don't really like going to the doctor. It's something we have to do, but you don't want it to be an experience where every time you have to go, you're fighting them. You want it to be something that they understand. It's just something you have to do.
Thank you very much for talking with me, for taking your time and helping the folks down here know about how to care for their children in a way that'll help them relax at the doctor's office and look around and enjoy the visit rather than be afraid. That's a wonderful thing for us, for you to be doing. And I just want to wish you the best of luck getting this all over the country, because we need to think more about our children. They are the future, and I've always just loved educators, because they're people that see the future and will make the future better, and you're going to do that, I think. So thank you very much for all that you do.
Thank you for having me.
You're welcome, and thank you for watching.